Healthy gums do not bleed. Gums bleed for a reason. As a clinical hygienist, if I see that your gums are bleeding, I am alarmed. I tell patients that if your nose or your ear or your eye was bleeding the way your gums are bleeding today, then you would be running to the emergency room. And then I have some people will say, patients will tell me, well, you're poking at them, so they're supposed to bleed. So really, I'm not poking at your gums. It feels like it when they're really tender, and so that's hard. So what I want you to understand is healthy gums do not bleed. And let's talk about why. So why should you listen to me? I'm a dental hygienist for 30 years in North Carolina, and I've been seeing patients all these years. Had lots of conversations and lots of wins, lots of challenges. But I am a dental hygienist, like I said, Restart Hygiene, so dental education company, here to educate you about your health and how it relates for your oral health relates to your whole body health. So let's go. So bleeding gums are called gingivitis. This is a fancy word for inflamed gums. Anytime you have itis behind a word, that means there's some inflammation. Now, we now know, which we didn't 30 years ago, or at least I did not know, that the mouth and the body are connected, and the inflammation from the mouth will enter your body once it gets into your bloodstream. Well, how does it get in your bloodstream? The bacteria lie along the gum line that come in from the air, that come in from our environment, lie at the gum line. So your tooth and your gum, where your tooth and your gum meet, gum line. If they don't get removed, this is plaque. If it does not get removed in that biofilm, the bacteria will sneak right down up under your gums. If they sneak down up under your gums, they're now in your blood path. So once they get into your bloodstream, now they're a part of your whole body. So now instead of us just cleaning our mouth and removing the bacteria there, our body's now trying to rid itself of it. And that's how the mouth and the body are connected. It's called the oral systemic link. So bleeding gums are not healthy. Everybody has had bleeding gums, and it's okay. There are reasons why your gums would bleed worse, but the reason that your gums bleed in the beginning is from plaque and bacteria. So there's good bacteria in your mouth, there's bad bacteria in your mouth. We always talk about the bad bacteria. So let's give a shout out to the good bacteria that keeps you healthy, it keeps your environment normal, which is good. So the bad bacteria are the ones that I want to talk about today. So when you don't remove the bacteria, the plaque, the biofilm, it becomes stickier. So the plaque becomes stickier, which is biofilm. When it becomes stickier, it's harder for you to remove. So you're brushing your teeth 2 times a day for 2 full minutes, which most of us do not, in my experience. So we're already at a disadvantage of having bacteria accumulate in our mouth anyway, which is an issue. So I do want you to set a goal to try to make sure you're brushing for the full 2 minutes, making sure your toothbrush is at the gum line, and making sure that you're brushing gently along the gum line. Hard brushing is not helpful. Hard brushing only irritates your gums, makes your gums recede, and it causes you to wear little notches at the gum line and causes sensitivity. So don't brush hard. Brush more is not better in this case. Okay, so if the bacteria accumulate, the plaque forms, it lays along the gum line, and it makes waste. You're going to love this. I always tell my patients your bacteria is eating, drinking, peeing, and pooping under your gums. Kids really like that. It's true though. Because of the bacteria's living there, it's doing all of its daily functions around and under our gums. That causes the gum to get mad and inflamed, so it starts to get swollen. So that's another reason we know that your gums are inflamed or that you have gingivitis, because your gums are swollen, they're red, they're really irritated, and they're just not healthy. Healthy gums are pink and tight to the teeth and healthy, just healthy looking. So when we go in there and we see that the gums are puffy, we see that there's bleeding, it starts to raise red flags. Now, depending on where the areas are at, it might need more of a focus. A lot of times if the top front teeth are really red, we suspect mouth breathing. A lot of times the lower teeth are irritated. That's because you have a lot of deposit or tartar down there, calculus. So those are some things we look for. Now, if the bacteria is allowed to sit on your teeth and we don't remove it well daily, then it would be in your bloodstream. So now this is a whole body issue. Now the oral systemic link, the bacteria in the oral systemic link from the mouth contribute to heart disease, strokes, Alzheimer's, dementia, low birth weight babies, some forms of cancer, and some kidney issues, because your body is the filter and it's trying to filter this bacteria out. So let's get back to why we want to make sure that you keep our gums healthy. So bacteria get inflamed because the gums get inflamed because the bacteria and plaque are just irritating them. So they get really red and inflamed and get swollen because they're trying to fight. At that point, the only thing that can happen is a good cleaning and some really good cleaning at home. So cleaning both ways. Now, if you let the bacteria sit there with the tartar and you let it irritate your gums long enough, it can start to irritate and dissolve your bone away. Now, the scariest part that I want you to remember about this is bone loss doesn't hurt. I've got bone loss for another reason. I'll talk to you later about that. But you can have bone loss and it doesn't hurt. So the only signal that your body's going to give you is that your gums are a little tender or they bled here. That is really all the notice you're going to get, which isn't much notice considering you could lose a tooth, because if your jawbone dissolves away enough, you will lose your tooth. And that's called periodontal disease. A lot of you know it by pyorrhea. That's an older term. We don't want you to lose your teeth. We don't want you to be unhealthy. We want you to be healthy. So if you have gingivitis, things for you to look for. You see a little bit of blood in the sink. You notice a space in your mouth that is a little tender. Well, pull your cheek back or your jaw back and look and see what's going on. Now, some ways that I like to clean gums besides the normal flossing, brushing, water picking, rubber tip, the little slim tips, and floss on a stick, I like to use peroxide. Now, caution you, peroxide too much can cause your mouth to dry out, which is another issue we won't discuss today, but we will later. So you can use a little bit of peroxide in the area, isolated in that area. You can use warm salt water rinses. That will help you as well. You can use coconut oil and pull coconut in your mouth for 3 to 5 minutes. Let that help heal your gums. And then just brush normally, gently, thoroughly at the gum line. And try to floss. But if you can't floss, there's other ways we just mentioned. Rubber tip. Floss on a stick. A water pick. I use my water pick every single day. It's awesome. So these are some ways that we can start to make sure that our gums are getting healthy, decreasing the gingivitis in our mouth. Hence, our whole body will be healthier if the bacteria are not allowed to get into our bloodstream. Good news is this is reversible. Gingivitis is reversible. It is the first sign of gum disease, but it is a reversible sign of gum disease. So please don't ignore signs of gum inflammation, gingivitis. Watch your children. They can have it too. This can happen at any age. I also wanted you to know that. So it is an issue for every one of us every single day. So brushing harder is not better. Some good ways and healthy ways to clean would be to water pick, toothbrush. I highly recommend an electric brush. My favorite is a sonic type toothbrush. The Oral-B's are really nice as well. Soft bristle toothbrush is very important. Gently along the gum line, but thoroughly. And time yourself. I challenge you to, next time you brush your teeth, if you don't have a timer on your toothbrush, set a timer on your phone, turn it upside down, brush your normal routine, and see if you're brushing for a full 2 minutes. Highly doubt you are. Without a timer, I don't either. And don't walk around the house with your toothbrush in your mouth thinking you're doing a good job. Be intentional with your toothbrushing. Make sure your toothbrush is at the gum line at all times unless you're doing the biting surface or your tongue. Really important. And last good little tidbit is if you have a lot of tartar on the lower teeth, a lot of inflammation here, take a dry toothbrush off the counter. Dry toothbrush. No paste, no water, no nothing. Manual toothbrush. Put it in your mouth, massage along the gum lines for 30 to 60 seconds before you brush with your regular toothbrush and toothpaste. You will see a great difference in the amount of bacteria and tartar on those lower front teeth especially. I'll tell you on the next video why we have tartar on the lower teeth as bad as we do. Hope this helps, guys.